So in this video, we're gonna do practice question and answer about heparin and warfarin, and also so in this video, we're gonna do practice question and answer about heparin and warfarin. So yesterday I posted a video about heparin and warfarin. I did compare and contrast about heparin and warfarin. So if you haven't watched that video, make sure you watch it first. And once you watch that video, you will be able to crack most of your answer, because the your Nclex, as I mentioned, your Nclex test is incomplete without heparin and warfarin questions, because the writer of Nclex, they must, and they always write question about heparin and warfarin, and without that the Nclex test cannot be published. So let's do. So if you have watched the video of yesterday, you will see how easy it's going for you to solve all of your problem. So let's start with. So in this one we're gonna do around like 25 to 28 question, and just wanna mention you, these questions are available online for free practice. Nothing belong to me. This is just I am using for learning purpose. So if you want to answer, so if you have watched the video and you want to answer it, so pause the video and try to solve yourself to see if you are getting correct answer, right? So let's do first question. First question is, when evaluating the therapeutic response for a client receiving a heparin infusion, which laboratory result should the nurse monitor? So what is the answer? So as I mentioned, the heparin, when you are giving heparin, you have to make sure you are watching APTT lab value, activated partial thromboplastin time. That is the lab value that you are going to monitor those who are taking as heparin, right? Moving on, next question. A client is receiving heparin. Just want to mention you that these questions are available online. So whoever is a creator for that question, all the credit goes to them. Nothing, no credit for me. I'm just using that as a learning purpose. So next question is, a client is receiving heparin therapy. Which laboratory result required the nurse to notify the provider? So A, B, C, D. What do you think? So when you are giving heparin therapy, you are monitoring for APTT lab value, right? As in the previous question. But the normal APTT value is 25 to 30 seconds. But those who are taking heparin, their therapeutic range is gonna be 1.5 to 2 multiply by 25 to 30 numbers. So that's mean the normal range is gonna be when 46 to 70 seconds. So in this one, APTT value is 90. It's above 70, so that's mean you're gonna hold the medication, you're gonna call the provider, and you're gonna give antidote. So answer A is your final answer. Question 3. A patient with deep vein thrombosis is receiving a continuous intravenous infusion of heparin. The patient activated PT value is 120 seconds. The nurse most appropriate action. So as I mentioned, 46 to 70 those who are taking heparin, but 120 seconds is too long, too high, right? So what are you gonna do? You're gonna stop, call the doctor, and give antidote. Option B is your final answer. A client receiving IV heparin for deep vein thrombosis, APTT 95. Again, APTT value is high. What are you gonna do? We're gonna do same thing. Option B, stop the heparin and notify provider. A client who has a new prescription for enoxaparin asks the nurse, how does this medication help me? Which response by the nurse is most appropriate? So what are you gonna tell the patient? How are you gonna educate them? So you're gonna say it will help prevent the formation of blood clot. So heparin, warfarin, and low molecular weight heparin, their job is to prevent further forming of new blood clots. They will not break down the existing blood clot, because if you want to break down the blood clot, then you need a thrombolytic medication. That's also known as clot buster medication, thrombolytic. But this medication, warfarin, heparin, and comodine, they gonna only prevent further forming of blood clots. So you will tell the patient answer C. It will help prevent the formation of future blood clots. What is the antidote of heparin? So what is the antidote? HP, right? As I mentioned previous multiple times. You have to remember HP computers, HP laptops. So HP heparin antidote is protamine sulfate, right? The nurse is receiving coagulation lab test result for patient who is scheduled for surgery later in the day and is not on any anticoagulant therapy, which result is an indication of increased bleeding risk. PTT value is 108. If the patient is taking next question. The result. Next question. The nurse is reviewing coagulation lab test result for a patient who is scheduled for surgery later in the day and is not on any anticoagulant therapy, which result is an indication of an increased bleeding of risk. So when you are giving anticoagulant, APTT and PTT value, you are looking for that, because INR you are looking with the warfarin. So that's mean APTT and PTT. So 108 PTT is a very high number. So that's the indication. So you are going to select that. And the patient is going to be risk for bleeding. APTT and PTT goes with the heparin. And INR, PT, INR. That's the lab value you're going to monitor. A patient is on continuous IV heparin drip for treatment of pulmonary embolism. Which lab should the nurse expect to monitor to evaluate the effectiveness of heparin? So when giving heparin, what we gonna monitor? We gonna monitor APTT value, right? A patient receiving heparin therapy suddenly develop bleeding gums and hematuria. Hematuria means blood in the urine. Which medication should the nurse anticipate administering? So that's mean what is the antidote for heparin? You're gonna give protamine sulfate. That's the answer you're gonna select. To reverse the effect of heparin, you're gonna give protamine sulfate antidote. A patient on warfarin has INR 5.5. What should the nurse expect? So those patients who are taking warfarin known as comodine. So comodine, the normal range should be in between 2 to 3, right? But the 5.5 is super high. So what are you gonna do? You're gonna do same thing. Hold, call, hold. You're gonna hold the medication. You're gonna call the provider, and you are going to give antidote. So in this one, what should the nurse expect? So what is the nurse expect? There is no order for hold, no order to call the doctor, but there is order to give vitamin K, because you're gonna give antidote, right? So you're gonna give vitamin K. That's the antidote for comodine, CK, right? A client is receiving heparin for deep vein thrombosis. Which lab test should the nurse monitor to evaluate the effectiveness of heparin therapy? So you're gonna monitor C, APTT value. When administering heparin subcutaneously, which action is correct? So if you have watched the yesterday video, it's going to be very easy for you to tell the answer. So you don't massage the injection site, you don't aspirate, what else? Inject into abdomen at least 2 inches from, that is your answer. So you give 2 inches away from the umbilicus. That's the option, because you have to give heparin subcutaneously, right? Sub-Q or IV. So when you are giving sub-Q, you can only give 2 inches away from navel. That is a best answer. You can give subcutaneously, but you cannot give this sub-Q. Only the muscle that you're going to use is abdominal muscle. So 2 inches away from the navel, umbilicus. Which complication should the nurse monitor for in a patient receiving heparin? So the heparin is only given for 21 days. But if it's given more than 21 days, then the patient is gonna develop HIT. HIT means option B, heparin induced thrombocytopenia. That's mean their platelet level is gonna start dropping. So that is gonna be the risky, those who are receiving heparin for longer period of time. A client is receiving IV heparin therapy for treatment of deep vein thrombosis. Which lab value should the nurse monitor closely to assess the effectiveness of heparin? So heparin, you have to monitor APTT value, which is option C. Your answer is gonna be same, but the Nclex, they're gonna twist the question. But at the end, your heparin, you have to monitor APTT, and with warfarin, you are monitoring INR. Easy. A nurse is caring for client receiving heparin infusion for deep vein thrombosis. The client APTT is 142. So 45 to 70 should be right. Okay, it says 60 to 80 should be therapeutic range when patient is receiving heparin. Which action should the nurse take? So stop the heparin. Stop, hold or stop, notify and give antidote. So stop first. What action you gonna take first? So you're gonna hold or stop. A patient on continuous heparin infusion for the deep vein thrombosis develop flank pain, abdominal distension, and a drop in hemoglobin from 13 to 9. What is the nurse priority? What action you gonna take first? Again, you're gonna stop the heparin infusion immediately. That's the first thing you're gonna do. Which client finding require the nurse to take immediate action in a patient on warfarin? So immediate action. INR should be 2 to 3. It's high here. Black terry stool. That's the that's the first thing you're gonna report to the doctor. The patient has black terry stools. That means they say internal bleeding going on, which is known as melena. Melena means stool in the blood in the stool. So that's the one thing. It's important, and you are going to take immediate action. You're gonna notify the doctor. Black terry stool is your first thing to monitor. That means there is active bleeding going on in the abdominal. A nurse is administering warfarin commodine to patient with a atrial fibrillation. The patient INR is 5.2. What is the nurse most appropriate action? The INR should be 2 to 3, right? And there is 5. So what are you gonna do? You're gonna withhold the warfarin and notify the healthcare provider. B. A client is prescribed warfarin. Which food should the nurse teach the client to avoid? Excessive intake. So you're gonna tell the patient to avoid in excessive amount is vitamin K rich food, which is gonna be spinach. You tell the patient to keep your diet consistently. You don't increase vitamin K food, you don't decrease. You have to tell the patient to eat consistent amount of vitamin K food as you were eating before. Because if the patient is gonna keep eating vitamin K rich food, that's mean what is the antidote for warfarin is vitamin K, right? So that's mean the patient is eating antidote. So that if the patient is keep eating antidote foods, that means the medication is not going to be effective. So spinach is your right answer in this one. A client is preparing to administer warfarin to a client. Which of the following are true statement of the drug? True. What has warfarin and heparin cannot be given together? No, that's wrong. They can be given together. Warfarin has an immediate effect. Which of the following are true statement? The true statement is warfarin has slow effect. The antidote is protamine sulfate. The INR 3.0 warfarin is therapeutic. Option D is your final answer, because when patient is receiving warfarin, the INR should be in between 2 to 3. That's the correct. The antidote for warfarin is vitamin K. Warfarin has immediate effect? No, that's an heparin has immediate effect. Warfarin is slow and it will take 5 to 7 days in the body to show its effect. Warfarin and heparin can be given together, because heparin is gonna work quickly while warfarin is gonna take 5 to 7 days. So patient cannot wait 5 to 7 days. So that's why the heparin is given for emergency patients, right? So at least it start working while the other one is taking to show its effect. Once the warfarin reach it to its level after 5 to 7 days, in between 2 to 3, then the doctor is gonna discontinue heparin. A client is receiving warfarin therapy. Which lab value? What is the lab value for warfarin? Your doctor is looking for INR. Where is INR? If there is no INR, then the option is gonna be PT. PT INR. Option A. Which lab value? Which lab would the mostly the doctor looking for INR, but if there is no INR, then you are going with PT. PT INR. Which lab would the nurse anticipate the provider ordering to monitor the effectiveness of warfarin? That would be option A, INR. A client on warfarin present with coffee ground emesis. What should the nurse expect to do first? That's mean you're gonna give antidote, because you want to reverse the effect of warfarin. toxicity. So you're gonna give antidote, which is vitamin K. A client has been on warfarin for several weeks already. Which of the following nursing intervention is most crucial for the client? Use safety razor. No. Ensure the client. Instruct the client to use soft toothbrush for oral care, because they cannot use a hard toothbrush because there is a possibility the patient is gonna bleed. So tell the patient to use soft toothbrush. Next question: a nurse is receiving medication for a client taking warfarin. Which medication would increase the client risk for bleeding? So when patient is receiving warfarin, heparin, the patient should avoid over the counter NSAIDs. So what are the NSAIDs? Aspirin is NSAIDs. Clopidogrel, which is also known as Plavix, they are also blood thinner. And also in this list, ibuprofen is also NSAID. So you tell the patient which medication would increase the risk. So ibuprofen would increase the risk. So those patients who are taking heparin and warfarin, they should avoid over the counter NSAID medication, and ibuprofen is NSAID. The nurse is reviewing the lab result of a patient taking warfarin for arterial fibrillation. Which of the following INR would the nurse consider therapeutic? So 2 to 3 is our therapeutic range, right? Where is, so option C, 2.4 is your therapeutic in range. The nurse is monitoring a client with AFib who is receiving Coumadin, warfarin, right? Which lab result required immediate intervention? So INR 2 to 3 is normal, right? So INR 1.2 required immediate intervention, because that's when the medication is ineffective and it needs to be increased. Whatever the dose patient receiving, it needs to be increased to bring this number 1.2 to in between 2 to 3. Because if the numbers are not between 2 to 3, if the number is 1.2, that means there is a possibility that patient is gonna develop blood clot. That's why we need to bring this number in between 2 to 3. Next question: a client receiving warfarin has an INR 5.2. What should the nurse do? Hold the next dose, then call provider, then give antidote. A client diagnosed with AFib is prescribed warfarin. The nurse cautions the client regarding dietary changes, which would alter the intake of which food group? Dark green leafy vegetable, that would alter the medication effect. So you tell the patient to eat consistent amount of that food. You don't have to increase, you don't have to decrease, but keep it consistent. That's the word Nclex looking for. Patient says that I'm gonna eat consistent amount of vitamin K, like green leafy vegetable food. Spinach, kale, liver, those are also vitamin K rich food. So that's a wrap of our practice question and answer, and I hope you are able to get a lot of answers correct, and I hope you got a good foundation on heparin versus warfarin. So I hope now on you will be less confused when you see this kind of question, and you will be able to crack all your answer immediately, right? So good luck and keep studying.